My name is Lauren Zayu, and we're back for the second season of Unbossed, Unbothered, and Unfiltered, the show about what you say and how you say it. We'll be chronicling the first 100 days of the Biden-Harris administration on everything from immigration to HBCUs. So join me for a crash course on this country's politics, current events, and how we move forward. Hello and welcome to Unbossed, Unbothered, and Unfiltered. I'm your host, Lauren Zayu. Today we're talking about reproductive justice with a dear friend of mine and someone who I've admired since we met at Spelman many years ago. Yemi Miller-Tonnet is a Black Queer Femme liberation strategist, abortion advocate, and reproductive justice organizer. She's currently the local campaign coordinator for Amplify-Ga. She has a background in intimate partner violence advocacy as a former legal advocate with Partnership Against Domestic Violence. And Yemi also worked as a bookseller for Charis Books and More, the South's oldest independently owned feminist bookstore. Yemi began her career in abortion advocacy as a front desk associate at Summit Medical Associates, an abortion clinic in Atlanta, Georgia. Yemi began her interest in liberation work as a comparative women's studies major at Spelman College, where she concentrated in Black women's activism. Also, Yemi works as a full spectrum doula, supporting marginalized folks along their reproductive journeys. I'm excited to welcome to Unbossed and Unbothered and Unfiltered, Yemi Miller-Tonnet. Hello, hello.
Hi, Lauren. Thank you so much for having me. I'm excited to be here.
I'm glad that you're here too. And so if we just want to kind of kick the conversation off with a bit of your background and how you came into this space.
Yeah, so I have kind of been working in reproductive justice in a lot of different realms for a little while now. At Spelman College, which is where we met, I was a comparative women's studies major, so was always kind of interested in feminist studies, and that was kind of my thing. I volunteered with a local abortion clinic in Atlanta called Feminist Women's Health Center, and that kind of opened my eyes to the reproductive justice world. And then right out of college, I ended up working the front desk at a local clinic here, an independent clinic. And so getting kind of that on the ground, seeing what happens in a clinic every day experience really just kickstarted my passion for policy and advocacy work, because that's kind of what I identified needed to be done in the clinic I worked in. So from there, I ended up going into a fellowship with Feminist Women's Health Center. I worked in domestic violence advocacy for a little bit, and I actually just started a job this week as a local campaign coordinator for Amplify-Ga, which is an organization that is kind of a campaign organization that supports some of the larger reproductive justice organizations in Atlanta. So yeah, I feel like I have my hands in a lot of different pots. I'm also a doula and training to be a certified doula. So doing birthing advocacy in that realm too. So I hope that explains a little bit about where I'm at right now.
Definitely. All good things. Congratulations on the new job. That has been a theme, I feel like, in the past, like maybe like 3 months or so. Everybody's like, look, wherever I'm at, I gotta go. So I can definitely appreciate the new job. But what I wanted to kind of double down on was your comments on reproductive justice. So I know we hear the words a lot about reproductive rights and abortion. So how do those work with reproductive justice, and how has reproductive justice, I guess, given us a different frame on that conversation?
Right. When we're talking about, our realities and our political lives, it's important to say what we mean, right? Mm-hmm. And I think that reproductive justice has been a really amazing kind of umbrella term that encompasses so much of these interconnected oppressions that specifically marginalized folks deal with. So reproductive justice, is really a political framework that houses the pro-choice, the abortion access movements. It houses the reproductive rights movement. It houses climate justice. It houses family justice, children's advocacy. All of these movements that are interconnected and intertwined is kind of fall underneath the umbrella of reproductive justice. But a little bit more kind of specifically what reproductive justice means and what it hints at is it is really about the right for anybody to have bodily autonomy, first and foremost, and for folks in terms of parenting to not have a child if that's what they choose, and to have a child in the most equitable and accessible ways that they see fit. And if they do have children, to raise those children in safe and unoppressive circumstances. And so I think that's something that we all relate to in some way or another, but there are definitely marginalized populations that have more difficulty meeting that criteria to living a free life.
Yeah, I think what I'm hearing is like an expansion of the way our bodies move in the world and ensuring that everyone has like a safe and equitable way to do that.
Right.
In whatever ways that those show up. And I think that is really important. And I kind of want to stick with the bodily autonomy piece. And I say that because a lot of my understanding as Black women, as a Black woman, is that my body is so often not my own in a lot of spaces, particularly politically. And so say more about like bodily autonomy and how important that is for people to have legislated and understand for themselves as well.
Yeah. And I think, bodily autonomy covers so many different topics, right? And there's so many ways that our agency and our autonomy is taken away from us as Black women. And obviously, birthing and childbirth is one of those things, right? Like as a doula, one of my biggest roles is not just, comfort measures during labor support, which is obviously a huge one, but it's also advocacy to make sure that, care providers are practicing informed consent, right? Like I always say this to clients, like there's a difference between I'm going to check your cervix right now versus is it okay that if after this contraction I check your cervix, right? Like those are two different conversations. There's a difference between I'm going to order this test for you or you need to lose weight versus let's have a conversation about your health and tell me what's going on in your life, right? And so those are the conversations that Black women have been dealing with. And every time we encounter a system, whether it's the medical system, whether it's the legal system, whether it's, schooling. And so reproductive justice is really a framework to say, hey, I deserve informed consent. I deserve to have my needs and my pains and my fears taken seriously. And I deserve to have governance over my own body and to make decisions about myself and my children that are deeply personal to me. So.
Definitely. And as we transition into Hold Up, you mentioned that you are training to be a doula. So can you kind of just explain to us what a doula is and how it's different than a midwife or OB-GYN?
Okay, yeah. So this might be a little bit of a long answer, but we can get into it. So doulas are non-clinical support. Both midwives and OBs are clinical practitioners, right? So OBGYNs, you would go to for a routine exam like a pap smear, or you might see an OBGYN if you become pregnant and you need prenatal care. Some folks choose to have OBGYNs attend their births and they follow them through their whole prenatal process. So OBGYNs are also trained as surgeons and can perform cesarean births as well, which is a major distinction between an OB and a midwife. Mm-hmm. A midwife does not perform surgeries. However, a midwife can attend a birth and support you through having a baby. Midwives are also, there's some discrepancy between, like what type of comfort measures can be used in terms of pain. So like if you're under the care of a midwife at home, for example, an epidural wouldn't necessarily be an option, but with an OB in a hospital, that would be an option. And in terms of where a doula comes in, a doula is a good person to have whether or not you're under the care of a midwife or an OBGYN, because a doula, like I said, focuses on advocacy for you and your birth plan and what you are wanting, and whatever circumstances you're giving birth under. And then it's also somebody who can help with labor support during the laboring process, helping you feel comfortable, helping move things along. It's also somebody beforehand, before you even go into labor, if you're a pregnant person, is somebody that can help you build your birth plan, help you find resources. They can refer you to different clinicians if you're in the care of a midwife or an OB that you're not vibing with and they're not respecting your autonomy, a doula is somebody that would help you unpack that, maybe find somebody new, or maybe even attend some of your visits with you to kind of, be that advocacy person in the room to say, hey, we're not comfortable with this, or, ask those important questions. So it's really somebody that is kind of like that person in the ring for you when you're coming up against these oftentimes racist and sexist institutions. And we know that maternal health is, amongst Black women is a huge, huge issue right now. And I think that's part of the reason why doulas, especially in the Black community, are becoming more and more popular. And I personally love to see that, not just because I am a doula, but because more and more when I do this work, I realize how sometimes life or death it can be. And it's really important. And also historically, just as Black folk, across the diaspora, we do not have a history of allowing our folks to give birth in, overly medicalized kind of clinical settings. Like that's not necessarily where we come from a cultural standpoint. And so doulaing to me is really kind of giving that indigenous spirit back into birthing, and really like going back to our roots where the granny midwife would come to your house and help you through what you needed, and would help tend to the kids and help tend to the house while you're, going through this life-changing moment. So it's something really special that I'm going through.
I'm glad to hear that tradition is still alive. My great grandmother was a midwife. And so it was very much, so that is something that I've reflected on a lot. And then also thinking about the fact that, one, I guess as a Western perspective, the idea is that like technology and science and medicine, like the advancement of it inherently means progress.
Right.
As though like we haven't been birthing since we've existed. And also keeping in mind that progress hasn't shown up for Black women in a lot of ways. I know that there were some really high profile stories. I'm thinking Serena Williams and Beyonce of like, these are rich Black women who are not receiving the care that they are owed at these places. And so I can definitely understand how people would go back to our roots in a lot of ways, because this isn't working for us the way we thought it would.
Exactly. Yeah. And I think that, over medicalization, that preference for, Western ideals is so dangerous, because it starts to make us second guess what has worked for centuries and what has worked in our communities, right? So I'm really happy about this, like going back to birthing basics movement. I'll plug some reading because that's what I do. I love books. But I just not too long ago got through a book called Birthing Justice, which is an anthology dedicated to, Black women and birth and pregnancy. And there was a specific essay in there that was about the granny midwives of South Carolina, and about how they were actually pushed out of their practices once doctors decided that they wanted to kind of take over the realm of birth. And so then all of a sudden these older Black women who had been birthing people in rural communities for decades and decades were all of a sudden being asked to stop using certain herbs and get certain licensures and go to certain schools and have certain things in their bag, and all of these type of kind of like over-regulation of what was already working for folks. And then there was, of course, like the racist stigmas of like Black people are dirty and, they don't know how to do certain things, and, white men who've gone to medical school know best. And so there's this history, right, of our bodies and our traditions being under attack. And so I think reproductive justice work at the end of the day is really honoring those folks and really trying to get back to making our decisions for ourselves, self-determination for our bodies, for our families, for our communities. I'm really happy to be a part of it.
And out of curiosity, as a doula, how long do you work with a client?
It's different for everyone, right? So I am a full spectrum doula. So not only, and we've talked a lot about birth, right? But doulas are not just for birthing people. I'm currently even supporting folks who are going through an IVF cycle currently. So I do fertility doula support. I do abortion doula support. There are postpartum doulas who, strictly come in to usher a family through that like kind of first couple of months of postpartum that can be really sensitive. There are also death doulas out there who are helping folks kind of redefine what it means to be alive and to die, and to kind of stop being so fearful of the death process, and to usher families through death and dying. So doulas are really about, again, like bringing these Indigenous practices back to our communities, and in all of the different ways that we go through life transitions. So yeah, there's so many different types of doulas. I do full spectrum work, which means abortion, loss, miscarriage, birth, and postpartum.
Okay. I love the idea of a death doula. I imagine you work with or the person would work with hospice or people who are dying, and so them through that part of life. So the idea that it's an advocate for you in birth and death, I think is beautiful. I didn't know that.
Yeah, and it's always it's like these different, we have so many life transitions that are medicalized, that don't necessarily need to be institutionalized, right? Like they're really personal and spiritual. And so I think doulas are a way to kind of bring people back to that space and really give folks the dignity in birth and death that people deserve, and often don't get when you're coming up against these large clinical institutions. Yeah.
So tell me about your training. How does that go?
Yeah, so I trained with Doula Trainings International. There are also so many great doula training organizations out there. Another one that I'll plug that is owned and operated by Black women is Ancient Song Doula Services. I think that they just started doing online trainings, but they're based out of Brooklyn, I believe, and they do a lot of great advocacy work. They also never turn anybody away for not being able to afford a doula. So good resources for listeners. But yeah, training is different for every organization, but often it can either be kind of a series of classes over an extended period of time, or it's maybe a 3 or 4 day intensive. The way that I did mine was several modules over about a 3-month period. So it was kind of going to online school for 3 months. And then there's an extensive reading list of about, I think, 12 books. And then, of course, auditing some classes. I just audited a childbirth education class specifically for families of color. And then also a lactation or parenting support group. There's several other requirements. Of course, attending actual reproductive events is one of them. So having a couple of births under your belt, whether or not you're assisting or actually attending as a doula. And that's also a good way for folks if you have financial struggles. If you are low on costs, a lot of times newly trained doulas who are going through certification might be looking to offer reduced rates or low cost or no cost rates to get their certification. So I always try to pair folks up who might not have the extra coin for a doula, but really do need one with those folks. So yeah, the training process can look different for everybody, but that's normally kind of what goes on in a doula training. You learn about advocacy. You obviously learn all about anatomy and birthing and the labor process and variations of birth, how things might go differently, or, and I don't want to say go wrong, because there's all different types of variations of normal that are still perfectly fine and end up with healthy folks. So yeah, it's a lot to learn, and it's one of those things that is really becoming more and more accessible, although not as accessible as it should be. I think we should definitely have a lot more Black women doulas and non-binary doulas as well.
Yeah, I could see that, because I was also thinking about a lot of times the conversation, particularly around birth, is centered on the child and what's best for the child. And even if you're a person who is pregnant, going through that process, they're going to tell you to prioritize the child. What I'm hearing about doulas is this advocacy for mom and baby, right? For I say birthing person and baby. Let's not and it's interesting, the idea that one would even think of those separately, as though what's best for the pregnant person wouldn't be what was best for the baby.
Yeah, no, when you bringing that up, that's such a good point. So I think that is a huge distinction as well, because I mean, to be quite frank, if anyone who's listening has ever been pregnant, like, and ever given birth, I'm sure they know, but like folks tend to zero in on the baby, right? Like on this new life that's coming in, right? If anyone in your life is probably, very concerned about the child's health, and so is the pregnant person. They're probably really concerned about the outcome of their birth, right? But it's like, who's looking out for you and your interests and what you want? And it really does matter how you felt about your birth, like how you felt about your care, how you felt about, this process. And that's really important to folks, as it should be. And so, the doula is like the one person in the room who's obviously worried about the baby being fine, everyone being safe, but is also concerned about the mental health of the parents and the dignity of the parents. And that is often lost in a lot of those spaces. And so I think doula's presence is like, the presence of a doula is really felt in the room during birthing, when it's time to speak up about like dignity and care and advocacy, right? And even in those like places where maybe someone's doing a home birth and it's not like a medicalized space or anything like that, and maybe they're getting excellent care, it's still somebody who, when you're in an extremely vulnerable situation, is on your side, knows what to do, and is there to support you. Folks are not meant to give birth alone. Like it's supposed to be an event that's, not that everyone should be watching, but like it's a community event, right? Children are not supposed to be raised alone, right? Like it takes a village type of thing. And I think that's where the doulas really come in.
Yeah. And as we've discussed, like across cultures, you see that much more than you see here. So a lot of, even at Spelman, like friends of mine who were from the Caribbean or from Africa used to say like, oh no, like you, like your mom and your aunties and everyone like comes around you and helps you do this thing, which I think is so important to remember, the community aspect, especially as we are in the panoramic, the pandemic, the Panera, because we have been so apart from so much community that it can feel alone. And one of the most harrowing moments, I feel like, were the images of women giving birth by themselves, or people in these situations where, you've got one parent outside, or maybe kids and things. It's the angst and separation that has been felt after being removed from one another for a year. There are, I guess, children who were conceived over the pandemic by now.
They're here now. They're real people now. Like they're they're here. I'm glad you talked about the pandemic, because so much has been revealed, like in terms of inequities in birthing, inequities in care amidst this pandemic. I think folks, the pandemic has really revealed a lot of really ugly injustices in our society. And I think the reason why so many folks are struggling also is because in our society, like we're really focused on this like nuclear family, if you are sick, you go to the doctor, like it's very westernized, right? And like we've lost a lot of that community. We've lost a lot of that ability to tap into other folks outside of our nuclear families. And I think, the reproductive justice movement, doulas specifically, midwives especially, have really worked to try to get folks back to like the communal roots. And also, I think folks who have doulas and midwives also just feel a lot more prepared to go into the like birthing and parenthood process. Folks like when you work with a client, you'll typically do like 2 prenatal visits, attend their birth, and then a postpartum visit. And so in those prenatal visits, you're getting education, you're learning all of these things about how to take care of yourself mentally, physically, how to prepare for birth, all of that. And those are like such ancient wisdoms that you might not even get in a doctor's office, right? Like they're not necessarily caring for you that holistically. I definitely recommend having a doula on your care team if you have access to one.
And say more about that preparation for the birth. Like, so you're saying that it's two visits. Are they spaced out? Is it like, second trimester, third trimester? Like, what ends up being the thing?
Yeah. Again, doulas have, varying ways of doing things. However, most common kind of package that I've seen is 2 visits, usually around like the 32-week mark, and then again at like maybe the 36-week mark, given that the birthing person, will go to full term, whatever that means, at 40 weeks. So yeah, usually 2-ish visits like that. And they're really, the first visit is honestly normally just unpacking what birth means to you and trying to figure out what an ideal birth process means to you, right? And that's not just, oh, I want to have a healthy baby. Of course you want to have a healthy baby, but what you want beyond that really does matter, right? Like, do you want your birth to feel empowering? Do you want to just not feel anything? Do you want it to, do you want to, is the fear of pain like the thing that's holding you back, or giving you anxiety? Are you concerned about your partner, and how they might support you? Is that a discussion that needs to be had? Are you, do you have a pushy family member who wants to be in the room, who you might not want to be in the room? All of those things are discussed, and it really is a moment to shine a light on the birthing person and maybe their partner, if that's who they choose to include in the process, and really hone in like what this process means and like ushering them through like a really major life change, right? And then on the postpartum, and then of course there's, attending the birth. But on the postpartum end, I think that's also really amazing, is because doulas are also usually trained to screen folks. And this is not like a diagnosis thing, but like screen folks for postpartum mood disorders, which we know is a humongous, red flag for folks who are getting through their postpartum days. So yeah, doulas are someone who can come into a home, see what's going on, get a feel for how everyone's feeling, and say, okay, yeah, this is, normal. Folks are tired and, things are hectic. Or say, you know what, I think we need to work on referring you to somebody who can try to mitigate some of the intense stress that you're feeling. And that's doing great work, because a lot of times folks deal with postpartum mood disorders far longer than they have to, or they do go to seek care and they're not believed, or they're told they're just having baby blues and all other types of nonsense. That is not helpful. So a doula is, again, someone in your corner who can stick up for you in those situations.
That is great. As we transition into I Ain't Sorry, I know we've talked about so much of the racism and sexism of the I guess, birthing process that can happen for so many people, and that's why people are turning to doulas. But I also was wondering, like, what have you learned thus far, or a philosophy you've developed even in your work that really sticks with you?
That's a good question. I would say, I think like revolutionary work or radical work requires a lot of imagination. And like, that's something that I've been coming into more and more the more I do reproductive justice work, the more I do doula work. I know folks sometimes side-eye radical folks or abolitionists or reproductive justice folks, or, quote unquote social justice warriors, because we, are very like, burn the whole system down, right? And I think the key part, though, is like, yes, we want to do away with these harmful institutions, with these systems that are not serving marginalized populations. But what's even more important than getting rid of the institutions that are harmful is building a world in the way that we want to see it, right? And that is a huge responsibility. It is a really freeing possibility. And I think that the idea of being able to like build something that has that can replace such an oppressive system is what excites me and invigorates me. And I think that that's really the work of doulas, right? Like we see what is not working, and we've built this infrastructure to save people's lives, right? And I think that is something that's often overlooked, and it is what really guides me in the work that I do.
And say more about saving people's lives. I just want to be explicit with people. I think I know.
Yeah. No, and when I say like doulas and midwives who are doing like decolonizing birth work, like to really like demedicalize and deinstitutionalize this work, like it is saving people's lives. Like if there is someone, like the fact that Serena Williams, I know you mentioned her earlier, had to like crawl out of her postpartum hospital bed and demand tests, like the fact that there are doulas in the room that are doing that for people, the fact that there are doulas in the room who are believing people's pain, the fact that there are doulas in the room that are asking racist nurses to please excuse themselves and, you know, find someone else to step in, that is saving people's lives in one way or another, right? And it's not always a life or death situation, but if, you know, sometimes it really, really is. And so I think it's important to like shout birth workers out for that.
Oh no, I wholly agree. And I do think it's a life or death situation. One, because as you mentioned earlier, the birthing process is exceptionally vulnerable. And so these are people who are in a very vulnerable position. And I also, slight story, at Spelman, I took biology of women. And so for part of it, we had to make a birthing plan.
Oh, really? I didn't know what that was.
And I remember so much, it's interesting to hear people's birthing plans because they are so completely different. But something that always really mattered to me in the idea that one day I may give birth is the energy in the room that the child is brought into. Like I was really particular about, like, you know, if we were gonna have music playing, if we were going to, you know, stage, like what we were going to do to make sure that it was as peaceful a process as possible. And so even something like removing people with bad energy, right? Or in the event that you are feeling anxious and overwhelmed because of, you know, the things going on, and having someone there to advocate for you in that so you don't have to do it by yourself, I think that is like something that gives life to people. And
it's also literally ushering a new life into the world, the way that like that family wants them to be welcomed into the world. And there's really like nothing more like, I don't know, that I'm proud of than being able to do that, right? There's so much that goes into honoring somebody's wishes and giving people birth with dignity. Like, and the fact that you mentioned that vulnerability and people are in that space, I mean, think about it, right? If you're going through the throes of labor and, you know, maybe there's a blip on the heart monitor or a deceleration in a fetal heart rate, and a doctor comes in and is like, your baby's heart is decelerating. Like if it's not up if it's not regular in 1 hour, we're going to do a C-section, right? And those are oftentimes how those conversations go. If there's not someone in the room who's like, okay. And so if in an hour it doesn't, and we say no to the C-section, then what? Like if no one's saying that, and if no one's telling the birthing person, no, you can say no. You can say no to this. But you always can say no to something. If no one's saying that, then it's like, then how did that doctor just influence your birth and influence your body and possibly put you into a situation where you needed major abdominal surgery for no reason? So those things happen all the time. There are hospitals in this country that have 60, 70, 80% C-section rates, and they're usually even higher for Black and brown women.
I fully agree with you there. And I do think it's so important to remember you can say no. I don't feel like that's emphasized enough. I think as Black people, as Black women, we are taught to make others comfortable. We are taught to go with the flow and to not rock the boat. And so someone saying like, okay, I hear you, but in the event we don't want that to happen, what are the other alternatives, particularly in something like a birth, right? Because there's all these other, I guess, factors that you're thinking about. And so someone who's like clear-minded and understands what you want and also what's best for you, I think is huge.
Right. Because it's like, if you're the one giving birth and someone, you know, says your baby might not be okay, of course you're just going to say yes to whatever they're offering, right? Without any question. And that's, you know, at the end of the day, what they're hoping you'll do. So yeah, I'm really glad to like know how to be that person in the room. Also in the medical field, like things can happen really quickly. And slowing things down is probably the best skill a doula has in the medical industrial complex, because everything can seem so emergent. Sometimes it is emergent, and if it is emergent, there are no questions being asked. It's just happening, right? Yeah. But if they're, in most cases, you can facilitate conversation, make decisions, and slow things down and ask questions, although they might not present the information in a way that is conducive to those conversations. They can slow down.
That is really, really good to hear. Kind of transitioning into our final segment, which I call Drunken Love. But just, I want to tell you how much I appreciate hearing your passion for your work in this conversation. A lot of times, I think, unfortunately, we are bound by so many other things that I don't think people get a chance to decide whether they like what they do, much less like have a passion for what they do. So I really can appreciate that you have this passion for your work, and that it really is such important work. And so I wanted to go ahead and say that, like, if for no other reason than like this conversation has been enlightening to me, just to hear that like advocacy for like arguably one of the most vulnerable spaces is the passion of someone who I find to be so bright and so brilliant, has warmed my heart immensely.
Thank you. And the fact that you thought of me to kind of like amplify these concerns and just, talk my ish on here. I appreciate you.
Yeah.
That means a lot to me.
Do you have like closing remarks, like anything you want to leave?
I don't know. I think I'm really glad that I exist in a space where so many Black folk have come before me who have laid the groundwork for this work, right? Like reproductive justice is not new. It is not, a creation that just was, it's a term that demystifies a reality that we have been living under for a long, long time. And having that language is so important. And I'm really glad to also hear that you come from a lineage of a granny midwife. I think that's amazing, because that's what it's about at the end of the day, like honoring our ancestors and living out what they worked for and continuing that work. And I'm just glad to be a part of it. And I hope that whoever's listening got a lot out of it, and maybe we'll check out some of the things that I mentioned. And if they're thinking about hiring a doula or going with alternative care with a midwife during a pregnancy or loss postpartum, whatever it is, that they feel confident in doing that and know that there are options to go to folks that look like them who will help them through their pregnancy journeys.
That is good to hear. As we've discussed, I've enjoyed you, but in the event people want to reach out to you or see more of your work, what's the best way they do that?
Yeah, so I have a professional Twitter. You can follow me at Yemisi Kambahi. And yeah, I'm sure you can put the deets on that.
Yeah, I'll include that in the show notes. Okay, if you give me 1 second to wrap up here, I do want to say something to you really quickly. You just finished this episode of Unbossed, Unbothered, and Unfiltered. If you're looking for the show, you can find us at Unbossed, Unbothered, and Unfiltered on Facebook and Instagram. And if you're looking for me, you can find me at LaurenZayu on Twitter and Instagram as well. Thank you for joining us. You just finished this episode of Unbossed, Unbothered, and Unfiltered with host Lauren Zayu and music by Lighthouse Productions. If you want to learn more about the show, follow at Lauren Zayu on Twitter and Instagram. You can also find more episodes on Facebook and Instagram at Unbossed, Unbothered, and Unfiltered. Thanks for listening.